So I usually expect to see somebody make a lot of change within the first 5 hours of therapy. And then depending upon like what their goals for therapy are, we might be done completely not long after that. Definitely, with brief solution-focused therapy like this, I'm expecting the therapy to wrap up within 6 to 10 hours of therapy. And I'm often working with people in double sessions. That's my preference, is to work not in the once a week 50-minute model, but at least once a week 110 minutes. And then the course of a treatment will be much shorter. So you can imagine, instead of taking 10 weeks to complete therapy that's going to help somebody eliminate depression as a problem in their life, they'll do that in 4 to 5 weeks. So the people who founded that whole school of therapy were psychoanalysts, right? So they were doing the 5 years on the couch, just meeting 50 minutes a week, and not really seeing anybody getting any better, right? So that kind of treatment can be very meaningful. Like, people find a lot of insight into themselves and learn a lot of things about themselves. But is their depression improving? Are they having less problems with anxiety? The people who decided to try something different were seeing, no, our patients aren't really actually getting any better. And so, people like Aaron Beck, my mind's going to go blank right now because you're asking me the question, but Albert Ellis, and even Dr. Burns, who founded TEAM-CBT and wrote the book Feeling Good that our institute is based on. What they discovered is this whole concept of thoughts are what cause our negative feelings. And when we can focus in on what am I telling myself that makes me feel depressed or anxious, and what can I tell myself instead, and the profound impact that has on changing how we feel in a really effective way that causes therapy to not need to go on for even months, let alone years. Right? Like, we can see sometimes somebody with an effective TEAM-CBT therapist, they can have 1 3-hour session and be done and find relief from a depression problem that they've been struggling with their whole life. So when I see that happening, when I got on board with that because I would go to intensive training sessions with Dr. Burns, and he would do live therapy work with somebody in front of all the therapists in the room, and see somebody make that kind of recovery, right? Like a huge change in like a 2-hour session. I'm just like, I want to do that, right? I don't want to have somebody drag out their therapy for, months and years and then maybe get like a 50% reduction, if that, 40% in their symptoms. And that's what you're seeing in most therapy. Like, when you look at the studies on most therapy that's treating depression and anxiety, like, at best they're getting like a 40% reduction after 6 months of therapy. And I'm not here to brag or like make myself out to be a superhero or anything, but I'll see somebody with these methods like make an 80% change in their symptoms in one session. Like, why would I not want to keep doing that? That's amazing to see somebody make that kind of change in their life in a short amount of time.